Driven by a medical code of conduct and a commitment to truth, though, a large group of infectious disease epidemiologists and public health scientists from around the world came together. They assembled a document and they signed what is known as the Great Barrington Declaration. And the first sentence of that declaration reads this, quote, "The Great Barrington Declaration, as infectious disease epidemiologists and public health scientists, we have grave concerns about the damaging physical and mental health impacts of the prevailing COVID-19 policies, and we recommend an approach we call focused protection," end quote. Then they go on to talk about that. Twila, this I know had to have gotten your attention. Can you share with our listeners effectively what this Great Barrington Declaration is all about? Who really is behind it? How significant is this declaration?
So the last I heard, there are somewhere in the order of, I heard somebody say 300,000 signers, and I heard somebody else say 500,000 signers. But it started with Dr. Martin Kulldorff from Harvard, Dr. Sunitra Gupta from Oxford in England, and Dr. Jay Bhattacharya from Stanford. And Dr. Bhattacharya and Kulldorff, they were both on with Florida Governor Ron DeSantis, maybe I think at the very end of September, if I'm correct, and he was talking to them about whether the lockdowns were good or not. It's a 2-hour roundtable with 3 epidemiologists and public health professionals. It's really wonderful. And the day after, DeSantis just lifted everything, and said that even the cities and the counties couldn't impose strict regulations unless they reported to the governor that they had a good rationale. So all the masking mandates went away. All of that stuff went away. And so these epidemiologists who are concerned all around the world came together in Great Barrington, Massachusetts, to sign this. And that's where it came out of. And then all sorts of people, from doctors to regular people to policy folks to concerned individuals everywhere, have been signing this. I believe there's like 30,000 experts within that whole group that have already signed it. The interesting thing, it doesn't really talk about the economic consequences, but it's really all talking about health and mental health and physical health, and the fact that all sorts of children are being denied access to school, and people are being denied access to, screenings or getting their cancer treated, all sorts of things that are happening. And they say this will lead to greater excess mortality in years to come, with the working class and younger members of society carrying the heaviest burden. And they talk about something called herd immunity, and I heard them talk about this with Governor DeSantis as well. They really believe this focused protection means that you focus on the elderly and protecting the elderly, and you let those who have really minimal risk, the young or the younger, so people under 60 is essentially, go off and have normal lives, because for the most part they're just going to get COVID-19. They're not going to suffer severe COVID-19, and amongst them all will be built up herd immunity. And herd immunity, which I call community immunity, herd immunity is when the virus has nowhere to go, because it keeps running into people who are immune. And either they're immune because they've had a different type of coronavirus in the past, and so their T cells are all activated. They've gotten COVID-19, and so they're immune to it. And, of course, if they've gotten a vaccine, they would also have immunity if any kind of vaccine was actually found. But what happens is it runs out of susceptible people, and then it just goes away, or it becomes endemic, which is what H1N1 is, which caused a pandemic in 2009. It's still here in the United States. It's still roaming around, but for the most part, people are immune to it, and so nobody even thinks about it anymore. And that's what they expect will happen with COVID-19. So this declaration is basically saying, let the young have normal lives, masks off, school in, shopping up, whatever. And then ask the elderly to be more protective and do more to protect the elderly.
And Twila, that's really what you've been saying all along, isn't it?
Well, I think you do have to look at who's dying, and who's dying are people who are elderly, 65 and over. There there are young people, there are people in every age that have died, but almost all of them have either, marked other conditions like obesity or diabetes or a heart condition. They're just more susceptible to the COVID-19, which enters the lungs and then has all of these impacts on the vascular system.
Well, that website, ladies and gentlemen, if you want to go there and look at it, it's a great read. It's not real long. gbdeclaration.org, which stands for Great Barrington Declaration, gbdeclaration.org. Can I ask you if you signed it, Twila?
I wanted to look at it in great. I don't sign things very readily.
Okay.
So
all right.
I wanted to look at it and see if anybody had any contentions with it.
That's good. I will say I read what I could read on there. I did sign it for whatever good that does. But it's an important thing. There's 22 countries on this page I'm looking at that have already, professionals from 22 countries have already signed, and they're adding very shortly Korea, Serbia, and Indonesia. They'll be the 22nd, 3rd, 4th, 26th countries. It's a very, very significant deal.